Hello, my name is Melissa Hensley. I'm a preventive medicine resident at the University of Rochester Medical Center. I'm going to be talking about eating disorders today. My presentation is titled Eating Disorders in a Global Pandemic. Eating disorders are a complex mental illness with biological, psychological, and social components. It usually involves body image. This is defined as one's thoughts, perceptions, and attitudes about their physical appearance. For example, how do you see yourself and feel about yourself when you look in the mirror? Body dissatisfaction is the best known contributor to the development of anorexia and bulimia. Risk factors include having a close relative with an eating disorder, such as a parent or a sibling, a history of dieting. It usually starts out as trying to eat a little bit healthier, cutting out certain foods, and then it may become excessive and turn into an eating disorder. Mental health problems like anxiety, depression, and obsessive compulsive disorder. Teasing and bullying, especially about weight. Having a limited social network, social isolation, and food insecurity can all contribute to the development of an eating disorder. Some of the warning signs that we should look out for as family members, friends, and health professionals. Making excuses not to eat or eating in private. Having complex rituals or behaviors involving food. For example, preparing your food in a very meticulous, methodical way. Withdrawal from family and friends. Loss of interest in once enjoyed activities. Rapid or excessive weight loss. Or in terms of binge eating disorder, you would have weight gain. Fatigue, weakness, dizziness or fainting, constipation, swollen glands from vomiting or knuckle calluses from self-induced vomiting, a slow or irregular heart rate, loss of the menstrual cycle, and dry skin or hair. These are some of the most common types of eating disorders. One is anorexia, which is a persistent reduction in caloric intake relative to the body's needs. And it's characterized by an intense fear of gaining weight or becoming what someone might think is fat. It's a disturbance in the way that one's body weight or shape is experienced. And the person usually has some persistent behaviors that interfere with weight gain. Bulimia is characterized by recurrent episodes of binge eating. And this is defined as eating larger amounts of food than most people would in a period of time, or a lack of control over eating in that episode. And the person has recurrent compensatory behaviors in order to prevent weight gain. And this usually involves self-induced vomiting, misuse of laxatives, diuretics, fasting, or exercise. And the binge eating and compensatory behaviors occur at least once a week for 3 months for diagnosis. Binge eating disorder also occurs on average at least once per week for 3 months. And this is associated with 3 or more of the following. Eating more rapidly than normal, eating until uncomfortably full, eating large amounts when not hungry, and then eating alone out of embarrassment or shame. And there's usually associated feelings of depression, guilt, or shame. The pandemic has increased most mental health problems in our country, and eating disorders have certainly increased as well. Food insecurity is one of the risk factors, and that happened in the pandemic, especially in the beginning. And people may have had reduced access to what they considered safe foods for the people who had a predisposition to eating disorders. People were purchasing food in bulk, stocking up so you had a large amount of food at one time, and then maybe you weren't sure if you were going to get more food a couple days later. So this increased binging and fasting behaviors. We're feeling out of control and anxious. People didn't know what was going on or when the pandemic would be over. We were worried about getting sick or our loved ones getting sick. we are relying more on social media for our social interactions, which can result in more comparisons between oneself and others. And there was a focus on trying not to gain weight as we were all isolated at home, people saying things like, don't gain the COVID-19 pounds, and not having the gym to go to, which for some people is an outlet. Increased trauma and abuse. Unfortunately, domestic violence and child abuse increased during the pandemic, and these are significant risk factors for eating disorders. We had restricted in-person access to healthcare, and so your primary care doctor or your healthcare team wasn't seeing you as regularly and checking in and making sure that you're doing okay. So that could really delay diagnosis and treatment. So the CDC actually found that the number of teens seeking care in the emergency room for eating disorders doubled during the pandemic. And call volume at the National Eating Disorder Association helpline increased about 40%. And treatment during the pandemic, like I said, we decreased access for face-to-face treatment. So this is maybe people who are already in treatment for eating disorders or people who are seeking treatment. And so we were forced to rely on web-based or telemedicine visits, which is a problem when you're trying to accurately gauge someone's weight loss or weight gain and their vital signs for assessment. And there are issues with confidentiality and privacy. When we were all stuck at home, some people found it difficult to get the privacy that they needed to have these types of visits with their whole family around them. And some people don't have access to reliable internet or electronic devices. So treatment and recovery, we are fortunate here in Rochester that we have some great resources for eating disorder treatment. We have the Healing Connection, which is for those ages 12 and up. They have a partial hospitalization program, as well as an intensive outpatient program and a regular outpatient program, so they can serve patients along the continuum of disease severity. And then URMC has a full range of coordinated pediatric and adolescent eating disorder services. And they're actually designated by the New York State Department of Health as a comprehensive care center for eating disorders. Most patients with eating disorders are seen on an outpatient basis, but there are inpatient services as well. And it's usually a team approach. We need medical providers to assess and monitor and treat the patients and make sure that their vital signs like their heart rate and their blood pressure are within normal limits and that they don't require acute inpatient treatment. And then make sure that recovery is slow and so that you don't disturb the electrolytes during treatment. So we educate the patient and the family about the illness and look for any underlying mental health issues like anxiety and depression and obsessive compulsive disorder and treat those underlying issues. A dietitian is part of the treatment as well to make sure that they get them on a healthy eating plan. Outpatient group therapy and support groups are important, and these can be done virtually or in person. And then mental health therapy for both the patient and the family, so they can sort of get to the roots of whatever familial issues may have also contributed to the eating disorder. So for further information, I would encourage you to visit the Child and Adolescent Eating Disorders Program at the URMC website. They have a lot of great information about eating disorders and treatments available, and they can be reached at 275-2964. And then the Western New York Comprehensive Care Center for Eating Disorders and the National Eating Disorders Association are both great resources as well. And the Healing Connection can be reached at 585-641-0281. Thank you so much and have a great day.